Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Waris. Welcome you all in Healthcare with Dr. Waris. Viewers, today's topic which I have chosen for you is hemiplegia, means the loss of sensation or paralysis of the one part of the body, means one limb and upper limb and one lower limb is called hemiplegia. When it is of lower side involves, then it is called paraplegia. When all limbs are involved, it is called quadriplegia. So it is one of the disease which I have told you before in my early videos, that there is a right of one person on his own body that he must have to check their blood pressure, your sugar level and hepatitis B and C and cholesterol. It's a right of one person on his own body. When we will be careful about these things, then this type of major attack like hemiplegia and CVA will not occur. When one person is facing this condition is due to the CVA and thrombosis and embolism in there, or hemorrhage in the brain, transient ischemic attacks, and when migraine like syndromes, head traumas, brain contusions, subdural hematomas, epidural hematomas, Todd's paralysis which occur after the seizures, and strong, and when it is a long standing diabetes mellitus, it also causes the hemiplegia. So these are the causes of the hemiplegia. Now come on the sign and symptoms. How will assess that this is hemiplegia? It represents with the difficulty in speech, difficulty in move, and without support one cannot move from one place to another, and this is the sign and symptoms of the hemiplegia. So now come on the treatment of the hemiplegia. No, there is no specific treatment of the hemiplegia, but we have to treat the causes of this attack. And so when we will treat the causes, the disease will be treated. Otherwise, it is not. And you use in this situation the blood thinners and antibiotics. Antibiotics will play a role in the and to control the infections which occurs after the head trauma and head injuries also. When we will treat the specific cause, then we will treat these symptoms of hemiplegia. Otherwise, it will remains. And so, there is physical therapy and rehabilitation therapy after this attack. It will also get some benefit. And there we have to use the mobility devices, supportive devices, and when it needs walkers, scooters to help and continue their movement and for life also. But when we will treat the causes, we can also cope with the disease very easily. This is all about our hemiplegia. Next time, inshallah, we will continue with another topic. Till that, take care of yourself. Thank you.